Imagine a healthcare system accessible anywhere at any time. For doctors around Wyoming, telehealth provides access to specialists and the ability to retain patients in the community rather than having to transport them. And you can complete medical education courses 24 hours a day, 7 days a week without having to leave your home hospital or clinic.
Here in Saratoga, we are a rural clinic, I would say based on the fact that we are 40 miles from the nearest emergency room, 40 miles from the nearest hospital, and 2.5 hours to either Cheyenne or Casper, which would be our closest referral centers. Population-wise, we serve, as a primary care clinic here, we serve from newborn up to the folks in the nursing home. Our population base is about 3,000, and we take care of everybody at all ages.
Dr. Bartholomew is able to show wound care specialist Dr. Sharp in Cheyenne exactly what is happening with his patient, and distance doesn't matter.
What telemedicine is all about is saving somebody some travel time, and usually a patient who doesn't feel too good, and the patients from Dr. Bartholomew, he has a couple that it's really difficult for him to travel and painful for him to travel.
Otherwise, our patients are traveling that 2.5 hours to Cheyenne or Casper, which during the summer is not a bad deal, but during the winter we have significant problems with the weather here. I would guess that the interstate is closed at least 10 to 15 days between here and Laramie or Laramie and Cheyenne, which then obviously prohibits getting our patients out to see the specialist. That really has been the driving impetus for us to get this technology going here in Saratoga, to get this program up and running, and that's where I think we're going to see the biggest benefit is in travel time, not only for the patient, but hopefully also for the specialist, so they don't have to drive or fly or whatever they do to get to Rawlins from Casper, Cheyenne. They can save their travel time, spend that on patient care time, and I think everybody wins.
The benefits of providing this kind of care are limitless, helping reduce barriers to access, increase efficiency for providers, reduce overall healthcare costs, retain resources locally, increase patient satisfaction, and improve the quality of care overall.
Well, I think the main thing we can provide is just a sounding board. We can talk to the doctors out there and find out what their problem is. It really suits infectious disease very nicely, because a lot of it is just going through the history and seeing what the exam was and what the labs were. So it works very well, and I think any doctor, especially somebody out in the boonies, and I've been there myself, you appreciate somebody to just talk to and try to help you think of things.
I do think that telehealth is going to be a big player here in the near future in Wyoming, just given the amount of time for folks to travel with the weather. There's just no reason why we should not be using this technology.
Recent changes to telehealth have made it easier and a lot more affordable for clinics and hospitals to use. Incorporating telehealth into your practice requires a high-definition webcam and a connection application installed on a computer at minimal cost to your clinic. The webcam is unobtrusive and takes up almost no space in a room or on your desk. Both ends connect with a click of a button or a directory entry to check and dial. A phone book will be made available online, and dialing is easy between the two locations.
The technology is very easy to use. The way I describe it to other folks is that this is basically a medical Skype. If they've ever used Skype before, which is a very simple camera-to-camera interaction with somebody else, the software is very easy. It's a one-click login. Then you click on a phone number for the specialist you're reaching, and then you're hooked up and you're ready to go.
If an immediate consult is needed as the result of a scheduled clinic visit, you as the referring provider gets paid for the clinic visit. Should a consult need to be determined, both endpoints get paid. should a regular clinic visit turn into a need for a specialist consult. The patient can stay in the room while a camera is brought in. The consulting provider can be contacted, potentially during the same patient visit.
My patient I talked to you, who had the Campylobacter infection and then developed possible C. diff. Actually, we're getting that toxin test run right now over at CRMC.
As the referring provider, you can provide more information and understanding during the consult. It is also valuable for continuity of care to be there during the consult, and any questions or future actions can be explained by the consulting physician or by you to the patient.
So far, I can tell you that being a part of the consult and being in a collaboration with the specialist on the other end has been very beneficial. Usually our communication is through notes, through paper, and happens days or even weeks after the patient is seen. With this setup, I can come into the room, I can talk to the specialist either during the visit or after the visit. This has really been beneficial, especially with our psychiatrist. He'll visit with the patient, I can come in later after the patient is out of the room, and we'll sit down and just talk about things that I've seen, things that he sees, and really we can put our heads together and make a treatment plan together right there.
For the patient, telehealth provides comfort for them and their families to get care where they feel the most comfortable, their home clinic or hospital. For doctors around Wyoming, telehealth provides access to specialists and the ability to retain patients in the community rather than having to transport them. Staying in the community hospital also brings an opportunity to keep lab work and testing at the community hospital. No matter who, no matter where, whenever your patient needs it, telehealth can get Wyoming doctors there. For more information about this video and telehealth resources, please visit WyomingTelehealth.org.